Hi, my name is Elizabeth Dilling. This is for International Health Systems at Purdue University spring semester. This is a comparative analysis presentation. In this presentation, we will consider health indicators along with 5 points to determine the current health status between countries in order to compare the health systems of the United States where you currently live and Canada. Both countries are developed and are able to fund their healthcare systems, have access to modern technology, and have governments in which the citizens can vote. However, the way in which their healthcare systems function is very different. Health outcomes, specifically life expectancy and infant mortality rates, are good predictors of overall health in a country. Here we will compare the life expectancy, infant mortality rates, and vaccine rates between the United States and Canada. In 2019, the population in the United States was 328 million, as compared with Canada, which was 36.5 million. Even with these vast differences in population, health outcomes do not differ by large amounts. Population growth rates are about the same, and predicted growth rates is similar as well. According to the World Bank statistics for 2019, life expectancy rates in Canada are slightly longer than in the United States, with the overall life expectancy at 82.05 years for Canadians and 78.79 years for Americans. Most recent rates for 2020 show infant mortality rates are similar as well, with there being 4 deaths per 1,000 in Canada and 5 deaths per 1,000 in the United States. Numbers for both life expectancy and infant mortality rates are better for Canada. Lastly, the World Health Organization measures vaccine rates by how many children have completed the DTaP series or are fully vaccinated against diphtheria, pertussis, and tetanus. In the United States, the vaccine rate is 93.8%, and in Canada is 91%. Next, we will compare healthcare spending in the United States to Canada. In the United States, they spend $13,590 per person, making 16.8% of the GDP. 49% is publicly funded and 51% is privately funded. In Canada, they spend $6,666 per person. That's 10.8% of the GDP, 70% being publicly funded and 30% privately funded. The United States spends over 2 times what Canada does on healthcare per person. The majority of spending is private in the United States at 51% compared to Canada at 30%. Public spending in Canada is at 70% compared to the United States at 49%. The U.S. and Canada both have decentralized healthcare. In the U.S., most healthcare systems make their own decisions on spending, getting reimbursed from private insurance companies or public government-run Medicaid or Medicare. In Canada, provinces and territories make their own decisions on healthcare spending based on reimbursements from Medicaid through the federal government. The U.S. healthcare system is not as simple as the Canadian system. The U.S. system is a mix of public and private, for-profit and nonprofit insurers and healthcare providers. Medicare, Medicaid, programs for veterans and low-income people, and the Children's Health Insurance Plan are all funded by the federal government. States manage and pay services on the local level with federal funds. Medicaid in the U.S. is financed through a combination of general federal taxes, a mandatory payroll tax that pays for hospital insurance and individual premiums. Private insurance, which is the main source of coverage in the U.S., is primarily sponsored by employers, and reimbursements are negotiated between employers, private insurance companies, and health service providers. Canada has a single-payer healthcare system, which is publicly funded through general revenue raised from federal, provincial, territorial taxation, and which includes person and corporate taxes, sales taxes, payroll levies, and other revenue. Their universal health insurance coverage provided through Medicaid is required for all citizens. There is no private options for general care or hospital care. Services such as prescription drugs, dental care, and mental health care are not covered by the Medicaid system, and therefore private insurance options are available for these services only that are not covered by Medicaid. Overall, healthcare system decisions are made by the people in both countries, as they both elect officials who make decisions on healthcare. Canada's attempt to provide everyone with healthcare was first demonstrated in 1984 with the Canadian Health Act, which established the Canadian healthcare system and universal coverage. Therefore, cost control efforts are established and maintained by the federal government, as they provide funding for provinces and territories. The United States just recently tried to expand healthcare coverage with the Affordable Care Act, which expanded Medicaid system and was the first time that private insurance companies had to meet certain core criteria set by the federal government. The ACA was also an attempt to cost control for private coverage by offering marketplace coverage and requiring that insurers planning to significantly increase plan premiums submit their proposal rates to either the state or federal government for review. Unlike Canada, though, most Americans have private insurance, and the federal government's role in healthcare is very limited. Next, we will talk about how the workforce is staffed. In the United States, most medical schools, about 59%, are public, with the average tuition of $39,153 for a public medical school, and $62,529 for a private medical school. 73% of graduates from medical school graduate with a debt averaging $200,000. Several federal debt reduction, loan forgiveness, and scholarship programs are offered, many of which target placement in underserved regions. Providers practicing in designated health professional shortage areas are eligible for a Medicaid physician bonus payment. In Canada, medical students obtain a medical degree from one of 17 public medical schools and pay an average tuition of $11,730 US. Of these graduates, 92% practice in urban areas, and there is no national program to promote practicing in rural or remote locations. However, most provinces do have rural practice incentives. After medical school in the United States, doctors who practice in primary care work for themselves in a physician-owned practice about half the time as compared to physicians in Canada who are primarily self-employed. Most specialists in the U.S. work for private practices or in hospitals as compared to in Canada, where mostly all specialists are self-employed. Ideally, patients in Canada have a free choice of physicians, but can be limited if physicians are full in their area. Similarly, in the U.S., patients have a choice of physicians. However, choices can be limited based on insurance coverage and other limitations. Lastly, we will discuss long-term care options. Both the U.S. and Canada have an increasing aging population, which also means an increased demand on the healthcare system for medication, home care, end-of-life care, and long-term care. Due to the increasing age of the population, healthcare spending will have to increase in both countries. As we saw previously, spending is already very high in the United States, but both countries will struggle here. One aspect to consider is long-term care. In the United States, there is no universal coverage for long-term care. However, Medicaid accounts for the majority of public spending on long-term services at about 70%, but only covers post-acute services following a hospitalization. Most employee-sponsored insurance only covers similar long-term care situations up to 100 days following hospitalization. Private long-term insurance is rarely purchased. In Canada, long-term care in a non-hospital facility is not covered under the provisions set by the Canada Health Act. Therefore, it is not covered by the federal universal health insurance system. However, provinces and territories governments fund these services through general taxation, which means coverage differs across jurisdictions. Generally speaking, long-term services are determined on a needs assessment based on health status and functional impairment. Government funds are spent on long-term care facilities for nursing care, plus supplements are added based on one's ability to pay for room and board cost. And in addition, some provinces have a minimum residency period as a current condition for admissions. Long-term care coverage and funds are very different in each country, both of which will be affected by the aging population and growing medical cost. In conclusion, overall, health outcomes in Canada and the United States are very similar, with Canada having slightly better health outcomes with a higher life expectancy and a lower infant mortality rate. When looking at the healthcare system as a whole, Canada is ranked slightly better at 10 in the performance out of the top 11 developed countries as compared to the United States, which is ranked 11. The cost of healthcare is dramatically different, with the U.S. spending 2 times what Canada spends. Canada has public universal health insurance as compared to mainly private funded insurance in the United States. All physicians educated in Canada go to one of 17 public medical schools, as compared to just half of Americans educated this way, with almost all Canadian physicians then being self-employed. Financially, both countries will be affected by their aging population and the need for long-term care, even though this care is funded differently in each country. It will put increase on the cost for both healthcare systems. These 5 points should give you an overview and a comparison of the Canadian healthcare system and the United States healthcare system. I appreciate your time spent. Thanks for watching.